Good afternoon. My name is Olusumbo, and I'm gonna talk about the anatomy of the eye. The eye has different sections. We have the sclera, we have the choroid. The choroid is the layer of the eye behind the retina. The aqueous humor is the fluid produced in the eye. The cones are the photoreceptor nerve cells present in the macula. The cornea is the outer transparent structure of the front of the eye that covers the iris. The drusen is the deposits of yellowish extracellular waste products which accumulates within the retinal pigment. The fovea, the pit or depression of the center of the macula. The iris is the colored ring of tissue behind the cornea which regulates the amount of light entering the eye. The lens is the transparent structure suspended behind the iris that helps to focus light on the retina. The macula is the portion of the eye at the center of the retina. The optic nerve is the bundle of nerve fibers at the back of the eye. It carries visual messages from the retina to the brain. The pupil is the adjustable opening at the center of the iris. The retina is the light sensitive part. This is the retina. And the rods are also photoreceptive. The sclera is the tough outer coat that protects the entire eyeball. This is the sclera. There are so many problems that we can see in the eyes. Some of the problems are the cataracts, and the cataracts are the opacity within the lens. It distorts the images and makes us have a blurred vision. And the cataracts can affect people, especially people that likes to drive at night. They will not be able to see. Sometimes people don't feel pain in the eye, or there might be redness in the eye. Treatment for cataracts. Actually, there are no treatments available because it's it's a kind of disease that we find it hard to get treatment for it. But sometimes we can do the surgery, which is the removal of the cataracts. The nursing management is to assess the patient for distance and near visual acuity, and we should make sure that the patient is given all the information about the surgery, pre-surgery and post-surgery, what the patient is expected to see after the surgery. And we should always try to comfort the patient if the patient is feeling any pain. Pain management is also essential for cataract surgery. We should ask for the subjective view of the patient's pain so that we can know how to manage it better. Another type of eye disease is the age-related macular degeneration, which is known as AMD. It affects a lot of people, and this affects the macular cells in the eyes. It makes these macular cells to be very slow, and sometimes there's an atrophy when a person has ARD. Some predisposing factors that causes ARMD is smoking, hypertension. We have two types of ARD. We have the dry and the wet. The dry is age-related, and it is an abnormal accumulation of yellowish deposits. The wet is very common and severe, and one can lose one's vision. Treatment is ophthalmoscopy, eye medications, and some other medications like bevacizumab, aflibercept, pegatanib. They are all selective inhibitors of endothelial growth factor. The last is the glaucoma, which is a disorder that is characterized by intraocular pressure, and sometimes there's an optic nerve atrophy and sometimes vision loss. So it is very common in African Americans, and we have different kinds of glaucoma. We have the primary open angle, we have the primary angle closure, and Treatment for this is just the use of surgery and medications. So the interprofessional care is to keep the IOP low, to prevent the patient from having optic nerve damage. They can also use a lot of different types of diagnostics to test for glaucoma. Nursing management is to work with the doctor, the other healthcare professionals to manage the glaucoma. Thank you. Have a wonderful day. Bye.